Okay, so you've just scrubbed your arms and now it's time to put on your gown and your gloves. Now, first thing first, when you walk into the OR, you want to make sure that you're holding your arms in the proper position. You want to make sure that your wrist is always above your elbow because you want the water to drip down off of your elbow. It's going to be the same way on both sides. And you want your elbows away from your body, not against your body where they can become contaminated. So you're going to hold your hands out in a position like this with your wrist above your elbow. You're also not going to wear your wedding ring like I did here. Now to dry my hands, I have to get my towel, which is on my sterile field. And technically you're not supposed to go over a sterile field with a non-sterile object like my hand. Even though it's surgically clean because I scrubbed it, it's still not completely sterile. So this is one of those cases where we have to make a little bit of an exception. We are going to go over it briefly, so we're going to do it very briefly and very quickly. I'm going to reach in, grab the middle of the towel, and pick it up and very quickly pull it away. When I do, I want to absolutely make sure, because my hand is wet, that I am not dripping onto my sterile field in any place, okay? So that doesn't happen a whole lot if you've done a full scrub. I will give you a little hint. Sometimes in lab, what we do is we just practice a little bit. So we'll just go in and wet our hands, then come out to practice this particular skill. If you do that, if you just wet your hands, if you haven't done a full scrub, you still have some oil on your hands and the water tends to drip more easily. If you do a full scrub, it doesn't drip quite as much, but you still want to be aware that you do not drip anywhere on your sterile field because any drop of water will contaminate your sterile field. So we're going to reach in again to the middle of the towel and pick it up. Now with the towel in my hand, I'm going to step well away from my Mayo stand because I don't want to contaminate that at all. I'm going to be moving this towel around a lot. I want to stay well away from that Mayo stand so I don't contaminate any of my sterile field that's still there. Now I'm going to hold the towel long ways and I'm going to open it vertically like this. And I'm going to lay the towel over one hand so that just part of the towel, the side of the towel, one side of the towel, is going over this hand. Now, this is the hand that I'm about to dry. So while I'm doing this, again, watching my elbows, keeping my elbows away from my scrubs. So I'm going to take my hand, starting with my fingers. I'm going to place it in my hand, and I'm going to use my bottom hand to wrap around each finger and drying each finger. Now what I'm doing here is I'm wrapping it around. I'm not rubbing the fingers. You never want to rub anything. You're not going to rub your arms. You're not going to rub your fingers. You're squeezing and you're patting. That's how you're doing this. So you're going to turn your hand over this way to get both sides of your arm. And then you're going to slowly work down your arm, wrapping around your arm, twisting the arm so you get top and bottom. Notice the bottom hand isn't moving a whole lot other than to wrap and squeeze the arm. Now, the other thing that I'm doing is I'm leaning very far forward at this point because as the towel gets closer to my scrubs, I don't want to contaminate the towel by having the towel touch the gloves because the towel, at least this part here, is still sterile. I want to keep it as clean as I can. So once I get all the way up to my elbow, I'm going to move away. I'm not going to go back down my arm. Once I make it all the way to my elbow, I'm done. Okay, that's it. So you want to make sure you spend some time getting everything nice and dry so that by the time you're at your elbow, you know you're done. Now you're going to transfer to your other hand. So the transfer looks like this. You're going to take the wet side of the towel, which is in one hand, and you're going to lay the dry side of the towel into the other hand like this. All right, and then you're going to hold the towel with that hand. You're going to take this hand, which now needs to be dried, and you're going to place it and do the same thing. Wrap each of the fingers around there, dry each of the fingers, patting and squeezing, but not rubbing, slowly twisting your arm. Notice it's my top arm that's twisting, not my bottom arm. My top arm that's twisting, I'm patting, going all the way around up to my elbows, and I'm making sure, again, that the towel doesn't touch my scrubs in this case, and then I can hand my towel off into a garbage can or to my circulator. So now that my hands and arms are dry, or as dry as I can get them with that paper towel, notice I'm still holding my elbows away from my body. I'm still holding my hands in the position where my wrists are slightly higher than my elbows. And I'm going to go in and get the gown itself. Again, this is also going to be a fairly quick motion. You're not going to worry so much about dripping on the sterile field at this point, but you still want to get it away as quickly as you can so that you're still not contaminating anything nearby. Now, the way I'm going to do this is I'm going to take my hand into the middle of the gown. I'm going to find this flap right here, and I'm going to put my thumb under this flap, and that is where I'm going to hold and squeeze the gown. Now, the reason I'm doing this is because I don't want to just grab the side of the gown here or here or here, because if I were to grab the gown here, look what's happening with my fingers. See how my fingers are actually touching the drape underneath? They're touching the sterile field. Well, my hand is surgically clean, but it's not sterile, which means I've just contaminated my drape. And I don't want to do this yet because I still have to glove, and my gloves are sterile. So I do not want to touch the drape or even really be anywhere near the drape if I can help it. So that's why I'm going to come down into the middle of the gown and put my thumb under here. One other thing you want to be aware of is the neckline. Anything in this little area right here, this is actually the outside of the gown. This is the part that has to stay sterile. This section here is the inside of the gown, and that is eventually going to become contaminated when you put it on your body. All right, so do not touch this area as well, because this has to stay completely sterile, this little corner here inside of that neckline. So again, I'm coming into the middle, putting my thumb under this flap, and I'm going to pick up the gown. Now, notice this gown picked up pretty easily. That's because this is a new gown. All right, if you're using a refolded gown, and we do that sometimes here in the lab. We have to refold our gowns in order to save your tuition money, right? When you do that, they don't stay together so nicely. What'll happen is you'll go and you'll pick up the gown, and then it'll just fall open and it'll contaminate all over the place, and it becomes a big mess. So here's a way of working around that. All right, so when you go in, you have your refolded gown. You're going to reach in, you're going to pick it up, you're going to pinch real hard, and you can tilt the gown slightly this way. You're going to tilt it away from this hand because you're going to use this other hand. You're going to bring it in, grab this gown, and then pick it up. So the tilting method looks like this. You're tilting it, keeping one edge of the gown still on the sterile field, bringing the other edge up, bring this hand in, and you can pull it back towards yourself. So that's with a refolded gown. Usually brand new gowns right out of the pack, you don't have to do that so much, but it's still good to know just in case. So when I go to pick this up, the gown should, in theory, stay pretty well folded. Now at this point, I'm going to adjust the gown and make it so that I can put it on. Again, stepping away from my sterile field, and I'm going to look for these pockets on either side. That's where my hand's going to go. The other thing that helps me remember this is look at the neckline. See this? Looks kind of like a smiley face. Okay, I see a smiley face there. The smiley face goes to the person that's being gowned. So in this case, I'm the one being gowned. I'm going to put the gown on myself. So the smiley face faces me. All right, if I were to gown somebody else, and we'll get to that skill later, the smiley face is going to face them. So if I'm gowning the surgeon, I'm going to turn the smiley face to face them. But for me, because I'm just putting it on myself, the smiley face right here is going to be facing me. And again, these pockets are where I'm going to put my hands in. I'm going to put my hands in on both sides, wrap the fingers around through there, and then open the gown up and let it fall. Now with the gown open and my hands in the shoulders of the gown, it's time to put it over my arms. Now there's a couple of ways of doing it. The way that I do it is to pull my arms slightly apart to about here. Now I want to make sure a couple of things at this point. One, my elbows are still away from my scrubs, all right? I'm not going to lean my elbows into my scrubs, so I'm going to keep my elbows out. And the other thing is I want to watch my sleeves, and I want to watch both sides to make sure that I'm not bumping into something. I don't want to bump into a circulator or a bed or a patient or anything like that. So I'm watching both sides. Now, when you do both arms at once to push them in, can you watch both sides? I don't think you can very well. So I like to do it one sleeve at a time. So what I'm going to do is I'm going to squeeze this one a little bit just to hold the gown in place. I'm going to look to my right. I'm looking this way to make sure I'm not bumping into anything, and I'm going to stretch my arm all the way in. Now once I have it to this point, notice my hand has not come through the sleeve yet. That's important. You do not bring your hand through that white part, that white cuff of the sleeve. I'm going to take that and I'm going to bring it into my chest and put it right here. That's where I'm going to hold it. Now with my elbow stretched out this way, I have tension and I can go this way. Now I'm going to turn my head this way so I can see what's on this side. Make sure that nobody's walked into my space or there's not a cart there or something like that. If I know that I'm clear, I can take this arm, push it in, again, just about to the sleeve, and bring it up to this point. So now I have my hands and arms pretty much all the way into the sleeve. So at this point, in order to close the gown, you're going to ask your circulator to tie you up. Now you can just stand there and wait for your circulator to do that, but most of the time in an OR, in order to save time, you're actually going to be stepping up to your Mayo stand while your circulator is tying you up. That way you can immediately start working with the gloves. So once your arms are in the gown sleeve and you're tied up, you can finally let your arms rest down to the side a little bit. And as you're approaching your Mayo stand, in order to put the gloves on, you got to be aware of one other thing. You got to be aware of this space in here, because notice my tag, I've not spun yet. I've not tied my gown here with this tag. So I do not want this to be contaminated by the part of the drape that's hanging over the Mayo stand, because this part is not considered sterile. That's contaminated. So I'm going to still stay away, and I'm going to lean in so that I can get to the gloves that I need. Now notice again, my hands have not come through the cuffs. That's why the cuffs, the ends of the cuffs, are still sterile, because I've not touched them yet on the outside. So at this point, I'm going to grab my gloves and open them up, trying not to move this sterile field, trying not to move this blue drape around a whole lot, in fact, preferably at all, because if it moves around, you're going to end up bringing unsterile onto sterile, and that's going to cause some issues. So you want to make sure you're doing this motion without moving this blue drape around pretty much at all. And I do this partially by taking my hand and placing it on the blue drape. That helps keep it in place. And I'll use my other hand to pick up the gloves and move them to where I want them. I'm going to place the gloves here. Now I can open the gloves, and I can reach in and grab the glove. So when these gloves come from the manufacturer, they're sort of pressed into these wrappers and then heat sealed. And when that happens and they're sort of stacked and packed together, the gloves themselves, they're sort of folded on each other. They tend to stick. One side of the glove tends to stick to the other side, and it makes it a little bit difficult to maneuver. So the first thing that I like to do is I take this hand and I press on the fingers of the glove, and I'm going to grab the folded cuff back here at the back, and I'm going to tug it slightly. And when I do, it releases. See how it releases? It releases this edge cuff right here, and that's going to help me get my thumbs in there in just a few minutes. So once that's released, I'm going to pick up the glove from the folded edge in one motion. This is one motion. I'm picking up from the folded edge, I'm taking my left glove, and I'm laying it directly over my sleeve. Watch that again. I'm picking up the glove from the folded edge and laying it right over my sleeve. Now at this point, notice that the cuff of my sleeve, the white cuff, and the folded opening of the gloves are pretty much lined up. That's the position that we want, all right? So as long as the two openings are lined up, we know we're in a good position. So with this glove resting in my left hand, I'm going to take my right hand and sort of pinch. I'm going to pinch here in the blue part of my sleeve. You can see that here. And I'm going to pinch this opening, the cuff of the glove, and pick it up into this hand. Once I have the cuff of my glove pinched with my top hand, I'm going to take both hands and press them together, and I'm going to flip it over. At this point, I can now pinch with this part of the sleeve and pinch this side of the cuff. So at this point, I'm now pinching both sides of this cuff. I'm going to take my hands, flip them back over. Again, I'm pressing my hands together to hold the glove in place, and I'm pinching both sides of the cuff. Now at this point, I'm going to hold the glove up, and I'm going to pull the top over the sleeve like this, and as the glove goes over my hand, I'm slowly going to push my fingers through that sleeve. Once I have it here, I'm going to grab both the glove and the sleeve. Not one, not the other, but both the glove and the sleeve. You want to make sure you've got it all the way around so that there's no white part of this sleeve showing. You're going to grab that and pulling both the glove and the sleeve, you're going to pull it down sort of at a sideways, back and forth motion, wiggling around and getting your hand into that glove. At this point, now you can straighten this edge, this back edge a little bit if it needs to be straightened. The other thing that can happen at this point is sometimes your fingers can get into the wrong holes of this glove. If it's easy for you to sort of move it from one finger, one hole to the other, that's okay. If not, wait until you have your second glove on. That's when you're completely sterile and you can do a lot of these adjustments. So I've got my one glove on, which means this hand is now sterile, and I can easily reach in and get my other glove. Now again, I'm going to do the same thing. I'm going to put my fingers on the fingers, and I'm going to grab this folded area, and I'm going to give it a tug. And again, that releases the gloves. You see how it lifts the cuff up there a little bit? That's going to let me get my fingers and thumbs under there. So once the glove is stretched out, I'm going to pick it up directly out of the package, grabbing the folded part, the part closest to me. I'm going to pick it up directly out of the package and lay it on my hand. And again, as soon as you do that, the cuff of this glove, or the opening of this glove, lines up with the opening of your sleeve. We're going to repeat the exact same process. I'm going to pinch this side of the cuff itself. It's easy to do now that I have one gloved hand. I'm going to flip over. I'm going to use my gown to pinch this side of the cuff. I'm going to fold back over, pressing my hands against each other to hold the glove in place. And then take this glove and pull it over the cuff like so. Again, making sure that the glove is completely covering the white portion of my sleeve. Now, once I have it in this position, I can do the little adjustments that I need to get my fingers through the sleeve and into the correct holes of the glove. Now, here's a tip. While I was pulling the glove over my hand, I was holding my fingers and thumb together in a position a lot like this. And I'll show you what that looks like without the glove and without the sleeve, so you can see just the position that you want to use. And keeping those fingers nice and tight in this little point here is really going to help you when you pull that glove over, because that way you can bring your fingers through that sleeve and into the glove itself. So now I'm going to do the same thing, but without a gown on. This is just to demonstrate what it looks like underneath the gown, what I'm doing with my fingers. You're not going to actually do it this way. This is just to show you so you can see my fingers as I put the gloves on. And just like before, I'm going to grab both the glove and the sleeve and slowly pull down, wiggling my fingers into the right spots. In this case, my pinky's stuck, so I can just adjust that a little bit. I'm going to adjust the pinky, pull slightly. I've got to get my thumb through there, and I can pull my thumb into the right spot. Now, once I have my fingers in the right spots of the gloves, now I want to pull down. I do not want to pull just on the sleeve itself, if I can help it, because the sleeve can very easily tear, especially with a tight glove on your hand. So the first thing you want to do is get your fingers all the way into the glove, and you're going to do that by pinching both the sleeve and the glove, pulling down in a couple of spots, a little tug, in each spot. You're not going to do a nice big tug all in one spot. A little tug here, a little tug here, a little tug here, bringing the glove down onto the fingers, and it's going to look like this. And notice the cuff is sort of around the palm of my hand and the back of my hand. That's the correct position because that way it's completely covered by the glove. If you need to make more adjustments, you can at this point. Say, for example, you had too much gown in your glove. You can very gently pull just the sleeve a little bit, just a tiny tug here, then a tiny tug here, then a tiny tug here, like a centimeter, half an inch. Little tug, little tug. If you do pull more than an inch or so, you're very likely to tear your sleeve at this point. So just very tiny tugs on the sleeve to pull it down into the right position. And now you're gowned and you're gloved. So at this point, the Mayo stand now has a glove wrapper and the gown drape still on it. Most of the time, you're just going to leave it there because your circulator will come and clean this off for you if you're fortunate to have a nice circulator to do that. Now, sometimes you might be the only one in the room, and if you go and you start setting up your back table and you realize nobody's cleared off your Mayo stand for you, you're going to have to clear it off yourself. The way to do that sterilely is to take your sterile hand, your sterile glove. You're going to reach in, pinch right in the center of the wrapper, pinching both the wrapper and the drape itself. You're going to hold your arm out, bring it over to the garbage can if possible, and not putting your hand in the garbage can but above it, and you're going to release and drop it into the garbage can. If you don't have a garbage can handy, you can take it and drop it, say, onto the OR table or something like that to make it clear it away from your Mayo stand so that you can now cover your Mayo stand. All right, so once you've got your gown and your gloves on, you're going to be really excited because you want to get over here to your back table. And the first thing you're going to want to do is come right up here because now you're sterile. You can come up here and touch your back table, right? Not quite yet. You've got one more step that we have to do. See this tag here? This is one last tie that we have to wrap around the back of ourselves in order to tie our gown properly. Now this thing sort of dangling here, this is not a good sign, especially when you come up to your back table, because look what happens. The tag now touches this part of the back table, which is contaminated. This part over the edge of the back table is contaminated. And if the tag touches this, you can then, as you're moving around, you're draping the tag all over the place and you're contaminating your back table. Not a good thing. So that's why it's really, really important. And a lot of students miss this one. It's really important to spin, and that's what we're going to call it. We're going to call it spinning, which is going to take the tie and drag it around your back and to the other side where we're going to tie it. And to do this, you're going to need help. You're going to need assistance from a circulator. So still staying a little bit back from your back table. You're not going to approach your back table yet. You're going to take the tag. You're going to use your left hand to hold the string. Now this is the short side. Notice it's attached right here. This is the long side. It goes all the way around and it's attached on the other side. All right, so this is the long side. The left side is the short side. And it's this short side that you're going to hold the string, the tie itself. With your right hand, you're going to hold the top of the card, which is where the ties are attached to the card. So the top of the card, the top half of the card, is your half of the card. And that's the part you're going to hold. So left hand holding the tie, right hand holding the card. So with my left hand on the short string and my right hand on the card, I'm going to pull my hands apart, releasing the short tie. Now with the card free, I'm going to hand the card to my circulator who's going to grab the bottom part of the card. Notice she's not anywhere near my hand. We're not contaminating each other at this point. I'm going to release and she's going to take the card around to the other side. As she does, I'm transferring the short string from my left hand to my right, like this, and I'm going to reach around. I'm not going to touch the card. The card is now contaminated. The string, the tie, is still sterile. So I'm going to grab this string and I'm going to pull, and she's going to take the card away and throw it away. You're going to tie your tie as far back, behind your back, over your side, as round to your back as far as you can, because you don't want anything sort of dangling down onto your sterile field. Now, once I'm tied, I can now approach my back table.